Hi, thank you for tuning in tonight. My name is Brittany, and I am the Deputy Director at the Chicago Abortion Fund. As you may know, I've been a long-time volunteer. I've been on the show several times. I was a long-time volunteer with the My Voice, My Choice Leadership Group, and I am so excited to step into this new role. Before we get going with tonight's topic, I just want to kind of let you know who we are, what we do, and why we do it. So like I said, I'm from the Chicago Abortion Fund, and about 27 years ago, women decided to start a fund that specifically helped women who were in their second trimester, because a lot of the times when women find out that they are pregnant with an unintended pregnancy, they're already close to their second trimester, or if they need to save up money to pay for their procedure, they're getting closer and closer to the second trimester. And then once they're in their second trimester, if you don't know, the fees do go up. So they decided to start an organization that funds second trimester abortions. And there's not that many that do fund second trimester abortions. And so within Chicago Abortion Fund, our new, well, I'm sorry, not our new, but our current executive director decided to start a leadership group. She had this vision of bringing the women back to the table that we serve, and what that means is former grantees will be brought back to the table and go through trainings and workshops and become educated on reproductive justice, reproductive choice, reproductive health, and women's rights and women's issues. And that is what I was a part of for the past 5 years, a little bit over 5 years or so. And so what the leadership group does, and its name is the My Voice, My Choice Leadership Group. What the women in the leadership group do, they conduct community outreach, and that consists of us choosing a location generally where we receive the most calls from women seeking funding in that area, district, or that zip code, and we go out and we put together these informational packets that has elected officials information on there. We choose a topic, whether it be STD, STIs, and HIV stats and rates in Illinois or in that area, whether it be about birth control and how to use birth control, what are the different methods. It's a list of topics that we include in the packet, and we also pass out our postcards that has our information on it, and some condoms. And we walk through that community, and we just try to educate our communities on reproductive justice and what reproductive health means and what they can do if they choose to get involved. We also have our educational forums, and that is where we utilize a space, and we also have topics that range from sexual violence, domestic violence, abortion, tracking your menstrual cycle, a host of topics. And we pass out flyers and have the public come in, and we host the forum. And that is really exciting because our whole goal is just to empower and educate our communities. And so far, it's been an interesting and amazing journey doing so. We also have our TV show, which comes on every last Wednesday of the month live, and you can also watch it on YouTube. And I'll have all our information and our overhead in just a second. And we also sit on panels for workshops, travel to different states, visit clinics, visit our elected officials, and try to educate them and get them on board with reproductive justice and what that is and what that means. And I'll also explain that in a sec. Right now I'm going to go to our overhead that has all our information on it. And as you can see, it's our name, Chicago Abortion Fund. Our address, 333 West North Avenue, Suite 267. That's in Chicago, and our zip is 60610. Our phone number is 312-663-0338. Our website, www.chicagoabortionfund.com. And if you want to send us an email inquiring about tonight's show or anything that CAF does, please go ahead and do so at info@chicagoabortionfund.com. Okay, and another huge part of the leadership group, especially for new members of the group, they teach us about the Hyde Amendment. So what that is, in 1976, a bill passed that basically says that no government funds will pay for abortion or contribute to abortion costs or anything. And that was a huge blow to the movement, because only 3 years prior to that, the Roe v. Wade historic decision was passed, and yeah, then they hit us with this. And what the Hyde Amendment is, like I said, it restricts government funds for paying for abortion. And so that means if you're on Medicaid or you receive your insurance from the government, if you're in the military, or you're on your husband's insurance and he works for the government, or you work for the government, like not just women that are on Medicaid, if you receive any government insurance benefits, you cannot pay for your procedure with that. And we work a lot around trying to repeal the Hyde Amendment because it's very unfair and it's unjust, and it goes against the Roe v. Wade ruling. I talk a lot, and we talk a lot about reproductive justice, and let me give you the full definition of that, and then we'll break that down and dissect it. Reproductive justice is a movement that envisions the complete physical and mental well-being of women and girls, which will be achieved when women and girls have the economic, social, and political power and resources to make healthy decisions about their bodies, sexuality, and reproduction. So, in a nutshell, that means that if women and girls, when they decide to become a parent, that they, first of all, they are able to make that decision on their own, and that they also have resources access to resources like quality health care. Their economic situation is supported, whether they're poor or low income or underemployed, like that they still have access to resources that will help them raise healthy and strong families. And this also includes men also. Men are not excluded from reproductive justice because men are raising their children in these same environments. Our women are raising their sons in these same environments. So we still need access to all of these things regardless if we're men or women. And a lot of times I think it comes across as being excluded from men, and reproductive justice and reproductive health doesn't regard them, and that is untrue. Something else that I want to talk about tonight is a huge victory for our youth in Illinois. House Bill 2675 has passed in the Senate, and so now it's off to Governor Quinn's desk awaiting his signature. What House Bill 2675 is, it's not a mandate, but it does state that if a public school decides to teach sexual education, that it has to be medically accurate, age appropriate, and complete. And I know you're probably thinking, because I know I was at first, like, well, aren't they doing that now? No. Some of the things they're teaching is not medically accurate, and it's not age appropriate, or they're not teaching them at all because they feel like there's nothing age appropriate, or that there's no gray area in there. And it is. A lot of opposers of this was questioning whether or not something was age appropriate for someone, say, in Cook County. Is that age appropriate for someone in DuPage County or some other county? Basically, there's not a huge city like Chicago. And again, we want to stress that the school they make that decision on what is medically accurate and what is age appropriate. Not what is medically accurate, I'm sorry, what is age appropriate to teach their students in their schools. So it may or may not be appropriate for each county the same, but you, in your district, in your school, you have to make that decision. Just to read off some of the current laws surrounding teaching sex ed in schools, and then what the House bill is going to make them do if they choose to teach sex ed. Right now, the existing law doesn't identify the various forms of contraception available to prevent pregnancy. It doesn't provide students with the stats on failure and success rates of various forms of contraception in preventing pregnancy, which itself is insane, because why would you not? No one wants to use something that has a high rate of failure, right? You want things that have a high success rate. It's not medically accurate. The objective isn't complete. Another one explicitly allows local school districts to choose and adapt the curriculum that meets the specific needs of the community. And no, as of now, the current law doesn't do that, but like I was saying, it lets your district decide what to teach. And we are all we're often asked, like with our community outreach and our forums, like what are our measurable outcomes, or how do we measure our successes and our outcomes? And I must say that this is definitely one of them, because we conducted community outreach in the 16th district, which is Senator Jackie Collins' district. She was a no vote at first, and so the weeks leading up to it was like, what can we do to organize and get her community and her constituents involved to call in and say, hey, you know, let's get your support on this, because we want this in our schools and in our community. So we conducted outreach over there twice, and then she was leaning yes, and then eventually she voted yes, of course, because it passed and we got all the votes we needed. So I just want to say, if you can, just reach out to your senators, your elected officials, and just thank them for voting for this, because if we're being honest, teaching abstinence only isn't working. I know people would love to believe that our children, they're going to wait, and we can teach them that, but that doesn't mean they're going to listen. And then you have to ask yourself honestly, did you listen, or did everyone that you know listen? And I have all girls, and that's just not a chance I'm willing to take. I teach them at home, and I also want them to go to school and get the right information also, and all of the information that's out there for them. So just be honest, and, you know, let's be frank. We know that a lot of people aren't waiting. The stats show people aren't waiting to marriage. There are a lot of unintended pregnancies, teen pregnancies that's unintended. So yeah, I think it's great that the bill passed. So if you can, please call and voice your support for your senator for supporting this bill. I'm going to go to our overhead one more time. And here's our information. Our Facebook information isn't on there, but you would just go to Facebook and type in Chicago Abortion Fund. We have a page, so please like us. We also have Twitter. You can just search us on there as well, and we just keep everything posted, and we have a lot of updates, so really check out our social networks. And all of this is on our website also, so please go ahead and check out www.chicagoabortionfund.com if you need more information. Turning tables on that, I'd like to talk about some of the bans that are going on, abortion bans that are going on in the nation. And I know that the last couple of shows we talked about some of the bans, so some of these are just updates and recent restrictions that are being imposed and enforced. One of them being in North Dakota. They have a 20-week abortion ban, and then they also have the 6-week abortion ban, which was introduced first. And basically that's saying once there's a fetal heartbeat that, you know, abortion is restricted. There have been some lawsuits against the state to stop that, and they're going to either file, or one of them has been filed already, because these bans are set to become effective August 1st. So the Center for Reproductive Rights are planning on filing a suit before that date. Also, there's only one abortion clinic in North Dakota in the entire state. And even though it's not in Illinois, it's not one of our neighbors, it still affects us, because it's like a ripple effect. Once one state is allowed something, it seems like then they have a precedent to follow, and then we'll have cases like in Philadelphia, which we'll talk about later. So there's one abortion clinic, that's the Red River Women's Clinic, and it's the only clinic in North Dakota, and they're suing the state over another law that requires abortion doctors to have admitting rights, admitting privileges to hospitals, and that basically is restricting abortion in that state in itself, because, let me read the 3 hospitals that they do have. One of them is a veterans hospital. One is has Roman Catholic affiliations, and the other one requires that a doctor admits at least 5 patients a year. Reps from the Red River Women's Clinic have already stated like that it's absolutely not going to happen as far as having 5 patients admitted per year, because of the thousands of abortion procedures provided since 1998 at that clinic. Only one patient has been required to ride an ambulance to go to the emergency room and receive care. There have been no deaths. So all through, and everything with these religious affiliations, I mean, they're not going to permit the doctors to have admitting admitting rights. So that in itself is just like banning abortion. So I'm going to keep an eye on that and keep you updated. You can also Google that clinic and Google North Dakota and see what's going on. And you can always voice your opinion online, or check out our website, and there'll be links to resources so where you can get involved, which is the whole part of why we have the leadership group and getting everyone else involved in what we do. There's also the ban that we talked about last month and the month before in Arizona. There's a 20-week abortion ban, and the 20-week abortion ban is popping up in several states, Tennessee and Kansas, but the appeals court struck that down in Arizona, so that is gone. Yay. They basically said it was unconstitutional and it goes against Roe v. Wade, and that is true, just like the rest of these bans. So that is some good news. And I also wanted to talk about, we talked a little bit about it last month, about the Philadelphia abortion doctor who has been convicted for what he did to the unborn, to the born fetuses that were born live. I read a quote that someone said, this is a prime example of why abortion should be banned, and I believe that it's quite the contrary. This is exactly why there should be no bans on abortion when the fetus isn't viable outside of the womb, because before Roe v. Wade and after, women have sought abortions. They are going to, the need is there, and women are going to seek abortion whether it's illegal or not. And when you have restrictions and you don't have the money to pay for your procedure, you're going to go to places that are doing things illegally. So these women were, because they didn't have access or they didn't have the resources to clinics that were safe, they went to his clinic. So I just have to disagree with that, and I just want to start the conversation. Like, that is one thing inside this entire issue, and then of course the media is going to flip that and try to really push like anti-choice comments and legislation and all of that. But this is exactly why we shouldn't, because like I said, women are going to seek abortion. Abortion isn't going anywhere. And women should have access to safe and healthy clinics and health services. And one more thing I want to talk about is county care. Before I get to that, I want to talk about our post-abortion package, because that has something to do with county care that I'm going to talk about. So for the women who call and receive funding from us, we send out a post-abortion packet, and based on the info that they tell us, we send out resources that we feel may be helpful to them. And we also include birth control information, condoms, and other resources. And we also include information on how to receive the pink medical card, which is for women who don't receive Medicaid or a medical card, and it's for like women health services. We also want to talk about the county care, because that is a new Medicaid program that is for uninsured adults ages 19 through 64. I want to make sure I have the right information. Okay, you need to live in Cook County, be 19 through 64 years of age, be a legal immigrant for at least 5 years, or U.S. citizen. You have to meet the income limits, and the limits are $15,282 of income per year for an individual, and for couples it is $20,628, and you have to have a social security number or have applied for one. And if you qualify for Medicaid or Medicare, then you cannot join county care. But I think this is worth checking out. I'm not endorsing it. I'm just saying please check it out if you're uninsured or you know someone who isn't, because it may or may not be helpful. But in case it is, let's go ahead and check it out. You can go to www.countycare, that's COUNTY care.com, and they have all the information you need on there. There's phone numbers and the times that they're available. So I would definitely check that out. And we're going to go to our overhead one more time. And as you can see, it's Chicago Abortion Fund. The address is 333 West North Avenue, Suite 267, Chicago, Illinois 60610. Our phone number is 312-663-0338. and check out our website at www.chicagooabortionfund.com. And if you would like more info, go ahead and shoot us an email at info@chicagooabortionfund.com. Go and search our Facebook page. Just type in Chicago Abortion Fund, and our Twitter page as well. And I encourage you to call in if you're watching. While we still have time, I'd like to share a story that a woman was brave enough and courageous enough to share with me, so I thank her for that. We were talking about abortion access, which is a huge part of CAF, besides the granting of the funds for women seeking abortion. This woman, she was a young white woman, and she was saying how she had the money to pay for her procedure. She had insurance to pay for her procedure. When she went to make her appointment, though, there was like a 4 or 5 week wait. And a lot of the times when we go into our communities, we're always looking at it from like the economic standpoint. And because we're here in Chicago, we have I don't want to say variety. We have about 3 or 4. We have some places where you can go if you choose to have that procedure done. But where she was, I mean, the demand was so high, and they didn't have that many clinics. But here she was. She felt like she was of privilege, or she had the money to pay for her procedure, and then she couldn't get it. So I really want to I really want us to talk about that, or start a conversation about access, because without access there is no choice. She chose to have the procedure done and had everything, all the steps in play that she thought that that's all she needed, but then since the demand was so high in her area, she couldn't get the procedure at that time, so then she had to travel somewhere to do it. And that's not just, I mean, that's not uncommon, because on the client line we have women calling in from other states, and they're traveling here just to have their procedure done. And then you have to think about the money going into that, paying for child care if they already had children, just paying bus fare, train fare, or gas to get here, and then where they're going to stay if it's a 2-day procedure, even if it's a 1-day procedure and it's late in the evening, and then traveling back home, missing time from work. So there's a lot of things that is very restrictive to access. Like, making the choice is not easy either. So making that choice and then thinking that, okay, now I've made this tough decision, now I can go and have the procedure done, and then there's so many other roadblocks. I think we really need to think about that and how that ties in with reproductive justice, because we're not having access to the resources that we need to make sound decisions and to raise our children, if we choose to have any, in those type of environments. I just encourage you to look up reproductive justice, visit our website and our Facebook page, and just really see what we're doing and see how you can get involved. Like I said, we do host our community outreach, so you may see us in your neighborhood at some point. It's very informal. We're just going out, meeting people, and passing out information, because that's the whole idea. We want to start the conversation, and that's another way that we do measure our success, because we're starting to hear it, or people see us and they recognize us when we come back to that area and host our outreaches a few weeks from then, that they remember us and they recognize us and they know what we're about. And that's what we want to do. We just want to encourage people to use their voice, because they have one and they deserve to be heard. So call your elected officials, because they work for you. And we just want to start the conversation of what is RJ, and how does it affect me, or how does it affect you, and what can I do? Because it's not just abortion. It's not only about abortion and abortion access. That is a huge part of it, but there's also, it also includes everything: having a nice clinic to go, a healthy clinic to go to, a safe environment to go to school in, having a safe school, and a school that's actually teaching, and having access to fresh fruits and vegetables, having nice, clean environments where there's no trash, no litter, and there's not any like toxic fumes being let out in the air. So many things. So please visit our website. I'm going to go to our overhead one more time so you can get our information. Once again, the Chicago Abortion Fund. Address is 333 West North Avenue, Suite 267, Chicago, Illinois 60610. you can give us a call at 312-663-0338. Please check out our website at www.chicagoabortionfund.com. And if you're interested in volunteering or would like any information on what I talked about tonight or what we do, please send us an email at info@chicagoabortionfund.com. Thank you, and you have a good night.